All right, let's just get right into it. If you've ever had that nagging, confusing pain in your lower back that shoots down into your legs, you know exactly what I'm talking about. You start wondering, is this a muscle, a nerve? Is it something serious? And honestly, that not knowing can be just as bad as the pain itself. And this quote, this just nails it, doesn't it? It's the core of the problem. It's that uncertainty that really gets to you, that sends you down that late-night internet search rabbit hole, worrying about every little thing. Well, here's how I want you to think about it. Let's reframe this. This isn't just random pain. It's an investigation. Your body is actually giving you a trail of clues. Your job is to become the detective and learn how to read those signs to figure out what's really happening. So, to crack this case, we're going to look at 5 key pieces of evidence. We're going to identify the main suspects, then we'll gather the physical clues from your everyday life. We'll also cover the urgent warnings you absolutely cannot ignore, decode what those medical reports are actually saying, and finally, map out your path forward. All right, first up in our investigation, let's get a really clear lineup of the 2 most common culprits behind this kind of nerve pain. So suspect number 1 is the herniated disc. Now, the best way to picture this is to think of your spinal disc like a little jelly donut or a tube of toothpaste. When it herniates, a little bit of that jelly-like stuff in the middle squeezes out and basically pokes one single, very angry nerve. It's a focused, specific problem. And then we have suspect number 2, spinal stenosis. This is a completely different kind of problem. Instead of one thing poking a nerve, imagine the whole tunnel that your nerves run through is just getting tighter. It's narrowing. So this doesn't just annoy one little wire, it starts to crowd a whole bundle of them all at once. Okay, so let's put them side by side because this is really the key. A herniated disc often gives you that sharp, zinging, electric pain, like a lightning bolt, and it's usually just down one leg. Stenosis, on the other hand, that tends to feel more like a deep, heavy ache or a tired feeling, and it often shows up in both legs at the same time. See the difference? So, how does this actually show up in your day-to-day life? Now that we know who our suspects are, it's time to gather some real-world evidence. The patterns in your own life are the best clues you've got. Here is a fantastic first question for your investigation. Think about it. If standing in a long line makes your legs feel just awful, heavy, and achy, that's a huge clue pointing towards stenosis. But if it's that long car ride that really flares up that sharp shooting pain, that points more towards a disc. It's all about which position is causing the trouble. And this is the classic clue. If you find yourself in the grocery store and you instinctively lean on the shopping cart because it feels better, you're doing what doctors literally call the shopping cart sign. Leaning forward physically opens up that narrow spinal tunnel, just enough to give those crowded nerves some breathing room. It's a massive clue for stenosis. This clue sheet really just puts it all in one place. You can see the patterns side by side. For a herniated disc, sitting for a long time is usually terrible because it squishes the disc. But for stenosis, sitting can actually feel good. And look at the next line. It's the complete opposite for standing up straight. It's these opposing reactions that give you the strongest clues. Just take a look and see. Which column sounds more like you? Okay, we need to press pause on the investigation for a second. This next part is incredibly important. There are a few clues that mean you stop being a detective and you get medical help right away. So please listen closely here. The things we're about to go over are not wait-and-see symptoms. They can be signs of really serious nerve compression that needs to be looked at, like, now. All right, here they are. If you have any sudden new trouble controlling your bladder or bowels, or new numbness in that saddle area, right where you'd sit on a bicycle, or if your leg weakness is getting worse really fast, like your foot starts to drag when you walk, that is a medical emergency. You need to get it checked out that same day. Okay, so assuming no red flags are flying, our investigation moves on to the expert testimony, your MRI report. I know this can feel like it's written in a totally different language, but we can learn to spot the key phrases. Think of this cheat sheet as your secret decoder ring. If you see words like focal disc extrusion, well, that's just the fancy doctor speak for that toothpaste squeeze we talked about. It points to a disc. On the other hand, if you see central canal stenosis or foraminal narrowing, that's talking about the main tunnel or the little side tunnels getting tight. That points to stenosis. Knowing these terms can, as one person perfectly put it, turn random misery into a map. So you've lined up the suspects, you've gathered your clues. Now for the most important part. How do you use all this knowledge to work with your doctor and find a path forward? Yeah, the good news is that for either condition, there's a pretty standard playbook. It almost always starts what's called conservative care: physical therapy, changing up your activities, maybe some medication. Things like injections and surgery, those are way down the road, and they're only really talked about if those first steps don't bring enough relief. And of course, we have to talk about the practical side of things, the cost. Now, these numbers can be all over the place, but it helps to know the general tiers. Getting an MRI is a big step. Injections are another level up, and surgery is usually in the highest tier. The main takeaway here isn't about the exact dollars. It's knowing that you can, and you absolutely should, ask for an estimate. It's a simple question that can save you a ton of stress. And we come right back to this idea. This is the whole point of our investigation today. By understanding your own patterns, the language, the process, you go from feeling lost in this sea of pain to being someone who actually has a map and can help navigate your own care. So let's make this super practical. What can you do in the next 15 minutes? Seriously, grab a piece of paper. Sketch out where your pain is. Is it one leg or two? Next time you walk, time how long you can go before the symptoms kick in. And most important of all, write down 3 specific questions for your doctor based on what you've learned today. You've done the detective work. You've gathered the evidence. You are no longer just someone with pain. You're an informed partner in your own healthcare journey. So what's that one key question you're ready to ask?